Good afternoon, everybody. My name is Jenny Pearson and I'm an Education Officer for the Primary Health Network. Welcome to our webinar today. Before we go any further, I'd like to acknowledge the traditional custodians of the land that we're meeting on and pay respect to elders past, present and emerging. I'm coming to you from Enewan land in Armidale in northern New South Wales. We have two presenters today. We have Ed Broadbent, who is a project lead for Every Mind, and we have Fran Groves, who is a commissioning coordinator for the Primary Health Network. Please type in your questions in the question box if you have any, and I will hand over to Ed.
Alrighty. Thank you for this invitation, Jenny and Fran. It's good to be here and connect with everyone, and great to hear that acknowledgement. I'm here on Awabakal land, and I'll be talking a little bit about what we do at Every Mind. So I'm just going to pull up my slides. So at Every Mind, we're a national institute focused on reducing mental ill health and preventing suicide. We have multiple program areas that we're currently leading, but I'm project lead on Life in Mind, which includes the National Communications Charter, which we're talking about today, and also another program that's called Ahead for Business, which are a set of tools that guide small business owners to look after their mental health and those of their employees. But yeah, here from Every Mind as a national institute, I'm really happy to be presenting Life in Mind to the PHN. So just to get into a little bit about Life in Mind, like I mentioned, it's a program of Every Mind, and it's a digital portal. So we're funded through the Department of Health under the National Suicidal Leadership and Support Program. And the aim is to reduce suicidal behaviour and stigma. And this is done generally through connecting with researchers and different organisations in the space and helping to translate information, data, policy and best practice approaches so that it becomes easy to read, understandable and usable information. So it's mainly based on the mental health and suicide prevention sector, but there's a lot of information on the website, including response pages for adverse events, etc. And we also have news that periodically goes out that tells about what's going on in the sector and research that's involved. Now, one of the things we're talking about today, which I think is of most importance, is called the National Communications Charter. But I just thought I'd give that framework of where it exists so we can understand a little bit about what we're working with. And so just going back, we're Every Mind that has Life in Mind program, and we're going to be talking about the Charter today specifically. So the National Communications Charter. The idea of this is it's a national document, unifying document to have everyone connected and using the same language around mental health and suicide prevention. I hope we've heard of it a little bit, but you can find a lot of the information we have online at Life in Mind. And I think it's a great document that guides all levels of organisations to communicate in this healthy and sustainable way around mental health and suicide. So going into a bit more detail, mental ill health, I should say, and suicide are complex and multifaceted, and the language you can use contribute to stigma and can alienate members of the community. So the idea of this document is to have safe communication, so it plays a role in reducing stigma and also increasing help-seeking behaviour relating to mental health and suicide. When organisations sign up to the Charter, like the PHN has done, it serves as this formal commitment to the principles that are contained within the Charter, and it's a guide including a lot of resources that help communicate in a safe way and have that consistent language across all sectors. So it was originally developed a long time ago, back in 2014, but it really came live in 2018 with Every Mind and with the then Minister of Health, Greg Hunt. And we also have a we're informed by the sector, but we're also connected to what we call champions, which would be more, I guess, known as an advisory group, which represent leaders in the field across different priority populations of ours that include the sector itself, Aboriginal and Torres Strait Islander people, LGBTIQ, and other groups. So we can have an all-encompassing and unifying document for us to talk about mental health and suicide.
Hey Ed, so sorry to cut you off.
Yeah.
I just want to let you know that we can see the toggling between the presentation and the document. It's not a huge drama, but I just thought I'd let you know.
No, thank you for letting me know that,
That's
friend.
okay.
Sorry, because I'm on one screen. I'll keep it there.
Of course. No, all good.
But thank you for picking up on that. And sorry about that bit of informal structure, but yeah, I can talk off the slides. That's fine. So we have 8 principles that are included that guide our communication, and that's so all organisations across different levels can respond to and talk in a healthy way about mental health. So, I just jumped out. There we go. Moving on to these principles. Here are the 8 listed in front of us. And so I'm just going to go through them briefly and give a bit of context to what they mean and how we can implement them. And then we'll go into a few of the guides and resources, and then I'll pass off to Fran so she can talk about what they're doing at the PHN in regards to the Charter. So the first priority is principle is to make mental health and wellbeing and suicide prevention a national priority. And that's the idea of having a unified and national document so everyone can connect and understand and use the same language around mental health or mental ill health and suicide. For us, it's really important that we can influence communication and everyone has that evidence-informed opinion. So we're having really good sense of communication and unifying our approach to reduce that stigma that can exist around mental health, and also promote help seeking within the community. And that's what it kind of is involved in the second message, where the idea is having consistent information and messages. And so rather than there being diverse ways that we're talking about mental ill health and suicide, we want to be having an evidence-informed practice so that everything we're doing within the field is backed up by the amount of research and policy that it forms the sector, and then that can be spread in an easy to understand way across all organisations. And that in itself is that advocacy and awareness raising, where we want to have clear, consistent, evidence-based messages. They all feed into each other, and that's how we create some of our resources and guides. And then also we want to be respecting the diversity of experience of those affected by mental health or suicide. So that's a key point of using some of our champions and understanding that we're not the expert on everything, and really looking to leaders within the area to inform our approaches and have a document that serves everyone within Australia. Now, this fifth one is actually getting updated at the moment because we're also including image guides, which we think is important in part of communication, but we want to be using appropriate, respectful and person-centered language in our communication. And so what this means, sorry, I'm going to just pull it up. So what this means is when we're talking to people, we're able to connect with them at their level, and we're respecting the difference and diversity between us. In that sense, we want to be working together to maximise our efforts and resources. Before the existence of the National Communications Charter, there was a lot of duplication, and the idea was for all the experts within the field to get together and make a unifying document. And also within this document, we want to be acknowledging those with lived experience of mental ill health and suicide. We shouldn't be making a document talking about mental health and suicide without consulting the people that have been affected by mental ill health or suicide. And from there, as we are a communications charter and it's an informative document, what we also want to be doing as we're connecting with subject area that's quite sensitive is also promote crisis services and help seeking information for those that are looking for information around mental health and mental ill health and suicide. So here's one of our guides This has been informed by one of our other program areas called Mindframe, and it's a language guide. Now, this is an evolving document that has a few quick tips and the reasoning why. And the purpose of this is that language is evolving and our culture is evolving, and certain people, especially in the lived experience and those that have experience of mental ill health, have said what terms are useful, and the evidence-based points to using different terminology in communication to make sure we're not creating stigmatizing communication. And by doing that, we're also allowing people to feel that they're supported and seek help. So going through a few of these just quickly, we do want to be saying things like people are living with or has a diagnosis of mental illness. A lot of the prior terminology that people use is really damaging and can be very sensationalizing and reinforce stigma. And when people feel isolated or they feel attacked for what they're going through or they have a diagnosis of, this can often reduce their help seeking. So we want to try and avoid some of that negative terminology that has been used in the past and using things like living with or has a diagnosis of. Similar vein, we can use things like being treated for or someone with a mental illness rather than being victim or suffering from, because we don't want people to feel that and using that terminology because it promotes a lack of quality of life, and people can live a healthy life with mental ill health and can also work through their situation so they are being treated for and can live a happy and productive life in that sense. A lot of these I'm going to skip over, I think, a bit now, but basically we're trying to use a more medical and guided form of speaking rather than one that seems to be based in some of our actions in the past that can be very damaging to the individual and stigmatizing. Oh, sorry, I didn't mean to skip them. And so another good one that I think is really useful to remember is when we're looking at someone's behavior, it's really good to say something like it's unusual or erratic. When we use things like crazed or deranged, it can be inaccurate and it can really cause damage to the people that are going through those behavioural changes. And also using what would be proper terminology when we're talking about treatments. So antidepressants and psychiatrists rather than some of those other words, colloquial words that can also be damaging. And also I think, which is really important takeaway for most people, is we want people to be seeking help and support by these help seeking resources. It's really bad to label someone as weak or that thing we've heard in the past of people snapping out of it, because what that is stigmatizing and really doesn't promote help seeking, which is what we want to do to prevent suicide, deaths by suicide and the increase in mental ill health. Again, some really quick tips, which I'm just going to check at my time. So I'll just move on quite quickly through here. So what we want to say in certain cases, for example, as I used before, is say something like took their own life or died by suicide rather than successful or unsuccessful, because that makes it sound like it's a desired outcome and it can really be difficult for someone to hear that if they're going through a lived experience or they've had a lived experience. Another thing is not trying to avoid that word commit, because it can align it with sin or a religious sense. So again, using that same terminology, and also not sensationalizing things. We can talk about increased rates or high rates rather than talking about epidemics. And that is far more scientific in our approach. Another point is talking about attempts rather than failed, because that again makes it seem like it's a desired outcome, and we can avoid that type of terminology by saying things like non-fatal attempt or suicide attempt. And also the word has been misused, we feel, in different contexts, and trying to not use the word suicide out of context. So we're not wanting to say things like political suicide or suicide mission, because we feel that is, and it is interpreted as an inaccurate use of the term. So I did want to just go through some of those resources at a very high level, and we have more on our website, and all of our other programs help inform this, but Life in Mind in itself and the Charter are that overarching document that help guide self safe communication around mental ill health and suicide. So if there are organisations or individuals here that would like to action the Charter outside of the PHN, or they would like to look at it for themselves and understanding communication, we have certain resources on the website that can help us through the process. Outside of the Charter booklet and the principles, we have also an action guide which helps us implement the Charter within our workplace, organisations, or at an individual level. And I imagine Fran is going to go through what they have done at the PHN, and I think with some of these resources it makes this process a lot easier and less daunting. We also have the action worksheet, which is a more guided way of going through a plan of how they're going to action the Charter in workplaces, and also some of these language guides that I was just referring to as well. We also have a poster which can be put into workplaces and organisations to help guide people on a constant level. But I think a key point of this is that teams and organisations can use this in the beginning to guide the Charter itself, to guide how they would implement in the workplace, and then bringing in their team or talking with their providers to respond to and encourage healthy communication around mental health and suicide. Now, I think I can leave a bit of time for questions, but we might do that at the end, I imagine. So I know we're talking about a few difficult topics at times, and they're quite sensitive. If you need, if some of this content has affected you in a way, please reach out using some of the support services that we've listed here, because again, we want to be supporting people. And just if any of this content has had an effect, please feel free to use some of these resources to support a conversation, a healthy conversation after this presentation. So thank you for your time. I'm really grateful for the invitation to present to the PHN and some of the providers about Life in Mind and the Charter. Happens to be on our 30th anniversary day, which I think I'll be going to very briefly. But yeah, once again, my name is Ed Broadbent. I'm project lead, and feel free, please, to contact us through Life in Mind or my email if you have any further questions regarding what we do or how to help implement the Charter in your workplace or organisation.
Thanks, Ed. Great presentation. And yeah, I'm just sort of going to jump off the back of what Ed has shared today. He's obviously spoken about Everymind's Life in Mind quite a bit, and also the Charter, and I'm here from the PHN to discuss how we have actually implemented it. So how you can actually do this in your workplace if it's something you're interested in doing, but also just hearing how the PHN has started to roll out some of those 8 core principles into our work. So sharing my screen.
Thank you for some of those technical difficulties. I hadn't realised at the beginning, but hopefully we went back on track.
That's okay. Thanks, Ed. All good. So again, I'm Francesca Groves here from the Hunter New England Central Coast Primary Health Network. And I would really just like to first as well acknowledge the land that I'm meeting on today, the lands of the Wonnarua people, and pay my respect to elders past, present and emerging. So where the PHN started with our Charter journey. So in 2022, HNECC PHN, we committed to signing the Charter and committed to those 8 core principles that Ed spoke about. Our CEO in the photo, you can see Richard, he signed the Charter on behalf of our organisation along with some of our commissioning team. And again, that was, the PHNs have a very broad and influential role in contributing to suicide prevention, as well as early intervention and in reducing the stigma associated with suicide and mental illness in Australia. So it was a really important step for us as a PHN to sign it and commit to the Charter. And then it's really come down to how we're going to implement it into our work. Sorry, there's a bit of a lag. So if we're looking at implementation, I just wanted to quickly cover, some of the principles we've implemented, and I guess how we've done that. So I just took 3 principles and sort of wanted to just talk around some actions. So principle 1, make mental health, wellbeing and suicide prevention a priority issue. Some of the ways our PHN has done that is we obviously conduct a health needs assessment across our entire region, and this identifies our key priority areas for commissioning and service delivery. Primary mental health and suicide prevention were identified among 9 other priority areas for investment and strategy, and so this is what we work towards. The 2 highest priorities of suicide prevention needs and target groups were follow-up support for those with suicidal ideation and follow-up support following a suicide attempt. And based on these, this is where our aftercare services come into full effect. So we've taken those 2 highest priorities around ideation and attempts, and we've implemented suicide aftercare programs across our region. So that's just one way we've utilised Principle 1. The integration of Principle 5, so using appropriate, respectful and person-centered language in all communication. So as Ed showed you, we have those charter language guides that are available, and we actually use them in our induction process for all new staff, which also includes our induction handbook. So as a new member to the PHN team, it's something we focus on really implementing in that induction process around what is the expectation of the organisation as an employee and how you can utilise it in your communications with stakeholders and also service providers as well. So we have the language guides placed in all of our offices as a quick reference guide. We also have, developed avenues for staff on how to actually discuss language, its importance and the stigma, as well as the implications for those phrases and terminology that are sort of outdated. So, there's this real emphasis on being accountable for yourself, but also knowing how to safely and I guess respectfully speak to your colleagues too about the use of outdated terminology as we move forward with, those evidence-based language guides that are founded on lived experience, and that's where we really need to move towards. We need to really listen to those voices of lived experience as the experts on what we should and what we shouldn't be saying. We've also done some training and engaged with SANE Australia. We've also had some domestic and family violence pilot training. So we actually have a deeper understanding of language and its implications within other areas of health. So like I've just mentioned, domestic and family violence, as well as our LGBTQI+ training, which actually talks about language and its impacts on various cohorts of the community as well. And lastly, I guess the implementation of Principle 6, so working together to maximise efforts and resources. So, the PHN obviously works very collaboratively with both of our LHDs, Hunter New England and the Central Coast. We have joint regional plans with both to ensure collaboration, shared resources and strategies align for the needs of our communities. So that's a big part of our efforts. Consultation and information sessions are regularly held with Mental Health and Suicide Prevention Commission service providers, not only to provide updates on areas of our needs assessment, but also to collaborate on engagement activities, share learnings, talk about, I guess, pilot programs that are working or aren't working, and look at how we can overcome those barriers. And I guess just another one was the PHN, hosts these sort of planning days. So we held our commissioning showcase earlier in the year, and we invited representatives from all the other sort of 30-odd PHNs to really bring together and showcase the innovative ideas and I guess programs that other PHNs are doing. And so we really want to leverage off that relationship and see what's happening across the country and where we can add value and vice versa. So what's next for the PHN with embedding the charter? I guess the first thing to note is we're definitely not finished. This is a continual and ongoing process, something that we look to work on every single year. And some areas we would like to continue to explore further is incorporating the voice of lived experience of mental ill health and suicide into our program development. So we have a clinical council and a community council. We sort of have those voices of various experience, but I think really embedding this voice of lived experience into some of our programs, and I guess what that looks like is something we're continually looking to add and incorporate into our work. And the promotion of crisis services and help seeking. So our commissioning team, we currently sit on 3 to 4 community collaborative groups, which actually are designed to assist with the response to post-vention incidents in our region, as well as prevention activities. And I think we play a vital role in that, working with our primary care workforce, so our GPs and allied health professionals. So it's more about understanding what our PHN role is in that, and I guess where we add value, but then how we can actually promote help seeking and advise on what our services capacity levels are looking like. So there's still definitely some work to go in that area. And I guess my final slide is just a little bit more around what you can do today. I know we've spoken at a pretty high level and I've spoken about what the PHN's doing. But if there are individuals or organisations sitting in this webinar that really want to know how you can implement the charter and what it could look like for your organisation, I've just got 3 takeaways from our session today. So number 1 was to visit Life in Mind and actually read more and find out more about the National Communications Charter. Number 2 was actually to just be familiar with the language guides on mental ill health and suicide. Again, like Ed said, these are continuously getting updated and may change, but I think it's just understanding what stigma looks like when you're actually communicating about mental ill health and suicide and those impacts on individuals. So the more you can do to keep yourself in check and others in a respectful way is, I think, something that will benefit the whole sector. Number 3 was actually taking one of the principles, so making mental health, well-being, and suicide prevention a priority, utilising the resources and information and take initiative in your own workplace to amplify, key dates, National Suicide Prevention Day, Mental Health Month, really recognising those key dates and taking that initiative to actually lead some of those in your own organisation. As well as utilising all the free resources that are out there as well. So if you do want any more information on particularly the charter and its resources, you can obviously speak to Ed from today's session as well. And if you wanted to have, if you had any questions around what the PHN is doing, I'm always here to speak about that as well. And yeah, I'm happy to take any questions if we have them now. Otherwise, I just want to say thank you for attending today's session. And yeah, we really appreciate your time. But yeah, I can hold over for a couple of minutes if there's any questions. Otherwise, you know where to find myself and Ed. There's none through on the chat.
Thanks so much, Fran and Ed. Just while we just give it a minute or two for the questions to come through if there are any, don't forget everybody that we will have a copy of this webinar with a PDF copy of the slides on our website. We have an education library and 95% of our webinars are recorded and we upload them. It should be up there by tomorrow or Monday. So please share with any of your colleagues if you think it might be of benefit to them.
Wonderful. Thanks, Jenny.
It looks like you guys have done such a thorough talk that there's no questions, so nobody needs any more information. That's fantastic. Thanks so much for your time and thanks everybody, and I'll catch you next time. Goodbye.
Thanks everyone.
Thank you very much. Wait.